Hey, welcome to TWIRx. I am your host, Todd Urey, founder of the Pharmacy Podcast Network. It is a big day here at the PPN. I'm excited to be here. There's so much going on. We have, oh my goodness, we have a discussion with Tiara Green, who is the president of the Advocacy Health team. I've worked with them over the years at the Assembia conference, as well as the NASP, the National Association of Specialty Pharmacies. Shout out to Sheila Arquette and their team over at the NASP. We're going to be talking about patients without insurance and how that's just a detriment to therapy. We're also going to be jumping in to the 24-day challenge, part of the 31-day challenge for the Pharmacist Challenge Month by Dr. Jesse McCullough. And then we're going to be talking with Mike Johnston from the NPTA. He's the CEO of the NPTA, about a meaningful recognition in World Pharmacist Technician Day, all on TWIRx. Hey there, Todd Urey over here at the PPN. How's your day been going? How's your week? What's been going on? We just got back from the NCPA in New Orleans. That was an amazing gathering of independent community pharmacists, entrepreneurs, surviving in such a volatile time in the history of pharmacy, the history of independent pharmacy, the history of community pharmacy, and how the collapse of so many chain pharmacies, including Rite Aid, is putting a crazy amount of pressure on our healthcare system and our communities not having access to pharmacies in their communities. So NCPA, shout out to you. You did an amazing job for the event 2025, bringing people together. We're going to have a post show. It's going to talk all about that. Today's TWIRx is brought to you by Advocacy Health. Like I said, we're going to be talking with Tiara. Very excited to be working with them, bringing us some update on financial assistance for patients. We are going to get into that. We'd like to get into some TWIRx news first, and kind of excited about we're leveling up with some of our news programs, our collaborations. And up first in TWIRx news.
And now for This Week in Pharmacy News, we have a story from Pharmacy Times titled, New Access Program Targets Women's Menopause Therapy Costs. A newly launched access initiative for Linkwit seeks to ease the cost burden for women receiving the dual neurokinin 1,3 antagonist treatment for moderate to severe vasomotor symptoms associated with menopause. The program aims to provide savings resources and support for those lacking adequate coverage. The therapy, developed by Bayer AG, represents one of the first non-hormonal options in this space, and the Access program reflects growing focus on bridging affordability gaps in women's health. Key takeaway for pharmacy teams? New protocols and patient education tools may be required to guide eligible patients through assistance eligibility and cost-saving pathways. Read the full article over at Pharmacy Times.
Next, from Drugstores News National Study, pharmacies can close care gaps and cut employer costs. A new report from the Health Action Alliance, commissioned by the National Association of Chain Drugstores, finds that pharmacy-based care holds significant potential for employer health strategies. According to the study, 89% of U.S. employees believe pharmacy-delivered care is positive. 71% believe it would improve their health outcomes. Yet, many employers remain unaware of the full range of clinical services community pharmacies can provide. The report suggests that integrating pharmacy services more fully into employer health plans could reduce costs, improve access, and address workforce health demands. For independent and chain pharmacies, this signals an opportunity to position pharmacy teams as care delivery partners with employers beyond dispensing.
Up next on TWIRx News, from OpenPR, wellness clinics and pharmacy partnerships emerging in the peptide space. Research peptide supplier AminoVault is planning collaborations with compounding pharmacies aimed at the licensed wellness clinic sector. These alliances will enable pharmacies to offer higher purity peptide formulations under compliant frameworks, supporting prescriber and compounding partners. Pharmacies exploring wellness clinic partnerships should assess legal regulatory implications, supply chain oversight, and clinical governance before launching or expanding in this niche. Contact pharmacy and healthcare attorney Brad Gallagher with Barclay Damon LLP for guidance. Head over to their website at barclaydamon.com. Don't worry, the link will be inside the episode show notes. Let Brad Gallagher know you heard about his firm on This Week in Pharmacy.
Hey, shout out to Brad Gallagher. I met up with him at the NCPA 2025, did an interview. So you'll be listening to his interview upcoming on the show. Peptides and what that means for your cash flow, what that means for clients, customers in your community looking for that therapy. You know as well as I do that they're doctor Googling things, and that's probably not the best way of accessing information. I think that's a good start, that at least they're familiar with things, but I'm hoping that they're coming to physician and pharmacists more about that. Continuing with the news.
Today's last TWIRx news story is from WWLP22 News from Boston. A recent study shows alarming drop in pharmacy access in Massachusetts. A Massachusetts study highlights alarmingly decreased pharmacy access in the Bay State. A report by University of California, Berkeley and other researchers revealed a troubling decline in pharmacy access. Multiple closures have left parts of Massachusetts facing real pharmacy deserts, particularly in underserved communities. This trend underscores the growing importance of community pharmacies as local access points for medications and care, raising questions for independent pharmacy viability, reimbursement models, and advocacy. Thanks for listening to TWIRx News, This Week in Pharmacy. Subscribe to all 40-plus podcasts on the Pharmacy Podcast Network on Apple Podcasts, Spotify, YouTube, Amazon Music, on Audible, and iHeartRadio.
Hey, thanks for listening to TWIRx News. If you want to be part of this publication, we are looking for experts in different segments that can bring us up-to-date information for the rest of the profession, really sharing with each other, growing with each other. And what that means, we cannot wait for you to hear our interview with Tiara Green, president of Advocacy Health, coming up next. Hey, special segment of TWIRx, This Week in Pharmacy. I'd like to welcome two of my friends. Met them through the specialty pharmacy sector, but they are here on TWIRx. Tiara Green and Jennifer Noonan from Advocacy Health. Welcome to This Week in Pharmacy.
Thank you. Thank you for having us. Good to be here.
Thanks, Todd. It's great to see you.
I know we only get to run into each other at conferences, so I'm glad you took time to come on the weekly show. And this has been a crazy week. We just got back from the NCPA. It's Friday, so I'm hoping the Steelers are going to do a little bit better this weekend. I don't know if you guys are watching any NFL or not, but
Go Giants.
The Giants, they actually did good last week, up to the last minute, I think.
They
right?
lost in the last few seconds, but that's okay. We'll make a comeback.
All right. What about you, Jennifer?
I like the snacks that go along with the season.
You can't.
How about that?
Snacks. Absolutely. We have some news to share with the listener. If you have ever heard of Advocacy Health doing some absolutely amazing work, met the team through being in the specialty pharmacy space. We've met at the Assembia events. We've met at the NASP events. But you're making national headlines for what help you're extending to people that are in desperate need of medication funding. And I was very proud to see, since we've been talking with you guys for over 2 years, that we just had a news release come out in September 30th of 2025. And the headline said, Advocacy Health expands leadership team, launches an advisory council to advance person-centered mission. The reason why this excites me is because when you start partnering with other people, it's really expanding your network, especially when they understand the intricacy and the complexity and how horrible it is to not have funding for medications that are desperately needed. Tiara, talk to us about your new council.
First, I have to say we are very excited to get these up and running. And I'll start by talking about the Medical Advisory Council. This is something that we've been talking about and are excited to launch because we are really seeking medical professionals who can help guide us and provide recommendations to our board of directors to ensure that as an organization, we're remaining at the forefront of these advances in healthcare. Every time you turn around, there is a new therapy that is available. Now we're talking about AI and its use in healthcare. And we want to consider those items when we think about our potential offerings. We are looking for members right now, actually. The Medical Advisory Council will consist of about 3 to 7 members, and they'll work closely with Jen. But we're hoping to have some practicing physicians, some pharmacies, and other experts in the healthcare area to work with us on this council. So in addition to that, we have our Patient Advocacy Committee. And this is a relaunch for us, really exciting. They'll be working very closely with Jen again. And in order for us to remain person-centered, it's important that we talk to the people, right? We talk to individuals with rare and chronic conditions to understand their journey and make sure that we are being mindful of that when we are implementing our programs and providing services to them. So both voices are very important in the grand scheme of things and important as we push our mission forward.
Jennifer, you and I have talked before. There's a richness that comes with understanding things from a nurse perspective, and you fused some of your experiences, most of your experiences in your life now with the pharmacy space. Can you open up about this patient advocacy committee and some of your ideas and leveraging the expertise that will be pulled through the committee?
Yeah. So I feel like this ties back to how you and I met. When I think about how I often tie in my relationship or our relationship as an organization within specialty pharmacy, when we think about the need for individuals to have help with that access gap, right? It's because these treatments, as Tiara just mentioned, are coming quickly, which is amazing, but they're also coming with a pretty big price tag due to the amount of research and development that has gone into the creation of those. And so first and foremost, we can't know all of the things about all of those rare diseases. And as we know, the patients and their families are typically the most informed expert in the group when you're talking about a rare disease. So bringing a medical advisory council together that can help us with their specialties be able to really look and drive down on the clinical side and the medical side. What do these diseases do when they impact a person, and how can we make sure we're including treatments in our programs or funding in our programs that will help with those gaps? But then in addition to that, those providers who are familiar with the science part aren't necessarily familiar with the lived experience piece. And I think if anything I've learned over the years, it's that the times I make the biggest mistakes or find that somebody maybe didn't get everything that they needed in their care, it came from times when we were in a rush and we didn't actually listen to the patient and ask them what it was that they needed. So I feel like the advisory committee with the medical professionals helping make sure that our programs are structured in a way that is inclusive of all of the disease. But we also have patients now that are sitting at the table with us and helping us understand exactly what it looks like in one area of the country versus another, in an age group versus a different age group. What do those experiences look like so that we, as support people, can help make sure we're touching on all those important parts that maybe aren't covered by health insurance or even thought of by other support areas?
You know, the outreach that both of you are intensely, you're out there, you're at the conferences. I see you at other, mixing into other care providers, pharmacist, obviously my favorite, but I don't get to go to some of the other ones that you're going to. Another aspect of your commitment is to educate the public, and Accessia Health was featured in a segment for the public specifically. And Tiara, you did an excellent job with this. Would you share this with our listeners if they didn't get to see this? And this was
Yes, yes, that was a segment with Virginia this morning. I had an opportunity to sit down with them and talk about the work that we're doing here in the organization. So, and for your listeners who may not be familiar, Accessia Health is a national charitable assistance organization who helps individuals with rare and chronic conditions access care. And sometimes it means helping to pay for their medication. Sometimes it means paying for their health insurance premiums, but we also have to educate individuals on the resources that are available. And so I joined Virginia this morning to talk about the work that we are doing in the organization, but also some of the struggles that individuals are having with paying for their health insurance premiums. And that has been an ongoing discussion and concern for many people who are receiving advanced premium tax credits that may go away as of January. So this is important work that we're doing in that we want to make sure that people can make informed healthcare decisions when they are looking at their health insurance plans, when they're talking to their physicians, and when they're advocating for themselves. That's the biggest thing. They have to be able to advocate for the care that they need and deserve.
I love it. I love the fact that we can get in front of news organizations to get the information out, and then as much as we can rinse and repeat that and educate
Yes.
the public of how they can get these funds. Because I mean, they don't know. I mean, the insurance is one of the most complex things in the United States, and it's unfortunate that it's as complex as it is. So having Accessia Health be a resource, that word out is so important.
I would agree. If we were to look at just a website on health insurance terms, there will be many of us who will have questions. So I can only imagine if someone doesn't have a healthcare background trying to navigate that space.
Yeah, I mean, I've been in the business for 22 years, and
Mm-hmm.
only now are PBMs actually something that I can sit there and describe, and it's taken a long time because it's a moving piece, and that's another reason that Accessia Health is so important, is because of the debacle and the craziness of demystifying our PBM issues that we're having in the United States.
Yes, it's all alphabet soup, PBMs and ATPs, and there's a lot of them.
ACA. Mm-hmm.
A, B, C, D, E, F, Gs. Those are the worst. All right, listen, listeners, pharmacists out there, especially any pharmacists that have been in disease state management, or you're getting into deeper into your consultancy with seniors, or really anything, let your patients know, let your people know about Accessia Health. Go to accessiahealth.org. Once again, that's accessiahealth.org. It'll describe the financial assistance, the educational resources, and the provider resources in reaching out to this team. Also, if you're going to be at a conference that Accessia is going to be at, reach out to the Pharmacy Podcast Network. We'd like to schedule time for multi-organizations to come together as the partners that you've developed here. We could really drill down into how you're working together. Give us an example, by the way, of an organization that would like to get involved. How do they work with Accessia Health?
I'm going to answer that one, Todd. We've been working on amping up efforts on building out a more robust and defined partnership, or way that we can continue to collaborate with other groups. And we have a few different levels of ways that folks can get involved with us. We work directly with advocacy organizations that support the same patients that we support, and those are our allies. So we love to group together with those folks that represent disease areas. This is still being built out. There are quite a few more individual advocacy groups, as well as larger national organizations that are supportive, like NASP and National Health Council, when we think about organizations that support a large group or network of stakeholders that are in this same pathway that our patients are. There's a partnership interest form that people can fill out, and we can set up a time to talk and just go over what some of those things are. These are not partnerships where we ask you for money or exchange funds. It's more of a help share each other's information out. But most importantly, it's about getting those shared resources to the patients directly. So we would love for anyone that's interested in that, so please reach out. And additionally, we can and do all the time meet and talk with specialty pharmacies that serve patients that have any kind of rare and complex health condition that might fall under our umbrella. We'd be happy to just provide an overview to help those providers understand how they can hook their patients up with different charitable organizations and get help for bridging those gaps and getting their medications.
Thank you for calling that out for partnerships. We do a ton of work with multiple organizations that, once again, they may be so busy they don't know about it. So hoping that this TWIRx will reach the right ears and they can reach out to Accessia Health. Jennifer and Tiara, thanks so much for being part of today's show. I really appreciate you guys.
Thanks for having us.
Thank you for having us.
All right, we'll be right back with more TWIRx. Hey everyone, it's Todd Uri with the Pharmacy Podcast Network. I could not be more excited to talk to you that we're going to be doing the SureCast with SureCost at the Insights User Conference on November 13th and 14th. I'm going to be part of this event. I cannot wait to meet with you, talk with you, leverage data together, learn how to use data better, and it's going to be an incredible opportunity to connect with other pharmacy owners and innovators, colleagues who are all working together for the same goal, helping pharmacies thrive. And what better way to capture those conversations than a live event? That's SureCast, and I can't wait to bring this to you, sit down with so many of you. This is going to be in Nashville. Don't forget, on November 13th through 14th, and there will be a link to go to the registration, and we'll see you there.
Hello, everyone, and welcome back to the 31-Day American Pharmacist Month Challenge. I'm your host, Jesse McCullough, and today I have a very special guest, Todd Uri. Todd, it is so good to have you finally on the 31-Day Challenge. How are you doing today, Todd?
I'm doing great. It's Friday. It's time to TWIRx.
It is.
We're here. We're back. It's so good to see you. Thank you so much for all of your support lately. You've been a leader in our first veterans focused conference that we just got done with. We're going to continue to mature that. Shout out to you and just your giving of your time for sure. And then, hey, thanks for putting this challenges together. This has been so much fun to watch and to use as a way to honor our pharmacists and pharmacy professionals. So this has been great.
You know, it has been fun, and it's also been there's been a little bit of terror that goes along with it as well, in all honesty. But you know, it's the idea comes to you and you say, hey, what can I do with it? And I said, you know, and I was just telling you before we started to record. It's relatively a short timeline that I was working with here, but whenever I said I need to do this challenge, I thought I need to get Todd on. And so for the very few people that may not know who Todd is, Todd, would you just mind giving you know, the 30-second background of the wonderful work you do in pharmacy, even though you are not a pharmacist?
That's true. Not a pharmacist, big pharmacist fan, understand the value of pharmacists in so many sectors. We cover, you know, and I've been around doing podcasting for 16 years. I've been in pharmacy for about 22 years, started in technology, and boy, and that taught me through reporting just how impactful I could see things changing in patients' lives, watching the consultancy and the dial-in, when we started in long-term care. But yeah, I'm a big fan. So I use all of my experiences and all of my gifts and my network to do nothing but boost our pharmacist voice.
And I cannot thank you enough for what you have done to help support pharmacists over the years. And it's really cool to see all the things that are starting to come to fruition here as well. Not the least of which is the work you're doing with veterans, as you mentioned just a moment ago. But when I had the idea for this challenge, the idea was, well, hey, 31 days, how hard can that be? And the answer is it can be very hard. And
Yeah.
I quickly had to quickly look for some help. But you were actually one of the people I thought of first. I'm like, I need to get Todd on because I'm sure Todd would have a good challenge to share with my pharmacy colleagues from coast to coast. So Todd, do you have a challenge you want to share with us today?
I really do. I want people that are listening to this and people that are connected to your network, Jesse, to support people that are putting their own time into building some of the best content I've ever come across in the entire healthcare system, and that is the hosts that are giving of their time and of their own expertise, and they're putting this content out on the Pharmacy Podcast Network. I would just challenge everyone to pick one show that you can find, whether that's Jenna Quinn or it's our specialty pharmacists that are out there, or it's a more functional pharmacy podcast. But I want you to pick a podcast. Tamara Rugels is constantly on talking about seniors. So go pick a podcast. Daniel Plummer with Maternal RX. I want you to listen to it. I want you to subscribe to it. But more than that, reach out to those people that are putting of their own time out. And these people don't make any money. Sometimes we get some sponsorship. Sometimes we don't. And it's still a way for them to advance their study, their experiences. Really, Jesse, it's an audio journal of sorts. It's not exactly a journal yet, although that's coming. That's evidence-based podcasting is coming, but it's very, very special. So this network has grown over the years. We have 42 shows now. We have more than 35 participating pharmacists who really put a lot of time in it, quality study, and then they're giving of their insights, and it's helping to drive us forward, because that's, if I think of what's happening out in the markets, we just got back from NCPA. This is changing community pharmacy. It's changing access to healthcare, and those stories have to be told. So I'm using our network that has over 80,000 downloads per month and thousands of subscribers to use this network to get out what's happening in pharmacy. And this isn't about me, it's about empowering each other and helping each other. So my challenge is subscribe to the Pharmacy Podcast Network, but I want you to pick a podcast. I want you to reach out to that host, whether that be LinkedIn, or if their email might be in some of the show notes, and just tell them, hey, I listened to your show and I think, I like it, or just encourage them and help this to move forward. And by the way, if you're listening and you want a podcast, reach out to me, because if you have a specialty that we're not covering, we're searching for oncology, we're searching for mental health, we're searching for cannabis medicine and leveraging that. So psychedelics. So yeah, it's a shout out. It's a challenge.
I will tell you, it doesn't matter what area of pharmacy you practice in, you can find something that will add value to you on the Pharmacy Podcast Network. And to your point, you have hosts that cover a wide range, but also to your last comment, there's still a few more, right? And that's actually how you and I connected. I said, hey, Todd, you're out here, you're promoting folks, and these are absolutely leaders in the pharmacy profession, but we need to talk about how do we create more leaders in the pharmacy profession as well. So it's really an exciting time for that. So as I understand it, the challenge is for those of you that are partaking in this challenge, go to your podcast app, find the Pharmacy Podcast Network. I'm going to encourage you to subscribe to the main feed, but then also more specifically, you can subscribe to the individual podcast. Is that correct, Todd?
That is correct. Yeah, we have Apple, Spotify as our main feeds, but if you go search for Danielle Plummer, Maternal RX, you'll find their podcast. We're building a new website to make that a lot easier for our listeners to start finding the individual show. That'll come out before the end of the year. But for right now, just do a Google search. Find someone that Jenna Quinn, Tamara Rugels, Daniel Plummer, So many of them have participated. And then your associations, ACP just started a brand new APC, Alliance for Pharmacy Compounding, just started the only podcast on the network that is dialing into how compounding is, number one, under threat because of things that are happening in legislation, and then number two, how it's growing and how it's an opportunity for pharmacists to do things that are a little bit different and empower their independent community pharmacy or whatever your sector or your specialty is. And yeah, just support the network as the network definitely supports you. And if you have a podcast, we would love to help you boost your word and tie you into this network, because that's really what it's about. We've seen so many things come out of the network where pharmacists work together and businesses work together, and it has nothing then to do with us. I feel like I hand the baton off to the next innovator or the next opportunity, and people run with it. So
yep.
This is part of it.
This is a fantastic challenge. Very much appreciate the work that you've done so far. I appreciate all, I'll even shout out to all those hosts and all those countless hours, and who knows how many edits that go through with all that. So thank you to all of those, all those contributors to the network. But Challenger, I want to encourage you, go find your podcast app. Make sure you've subscribed to the Pharmacy Podcast Network, and it's amazing how you will begin to expand your awareness, even in areas that you may find new areas that you didn't even know existed. That's the wonderful part of it. Todd, before we wrap up, anything else you want to add to the conversation today, my friend?
No, let's remember each other. Let's remember to just reach out to each other once in a while. This is not an easy business to be in. It's not easy to make money at something that's never been there in the existence. You're building something from scratch. So shout out to our entrepreneurs that are out there that are pharmacists wanting to build businesses. If there's any way I can ever help you, giving you advice on public relations or marketing, and I'm not even saying to get involved or use us, but I love talking to pharmacists, and most of the time I'll turn it into a podcast. So you might end up on This Week in Pharmacy.
There you go. All right, folks, we'll move in to wrap up for today's challenge. You know how we do this. I remind you at the end of each challenge that this challenge is not just for you. I want to encourage you to take this challenge, share it with at least two of your colleagues, the two other colleagues, get them involved in the challenge. And because we all get better when we each get better. And so go out there, complete this challenge, and we'll see you back here tomorrow with our next challenge. Have a great day. Have a great day, everybody.
See you.
Feeling lost with the complexities of pharmacy accounting?
In pharmacy today, there's so many different, variables and issues that impact the pharmacy books, records, accounting, the profitability of the store, so forth. There's different components of pharmacy that have its own nuances from an accounting standpoint. And so it's tricky. There's no doubt about it.
Ready to take your pharmacy to the next level but don't know where to start? Sykes & Company is here to help. Introducing the RX Assessment. With the RX Assessment, the pharmacy CPAs and advisors at Sykes will do a deep dive into your accounting and tax situation and give you the action steps you need to take your pharmacy to the next level.
If you're interested in, working with a team who understands the industry and how the accounting and tax should really be in a pharmacy, this is your chance to get a under the hood check of what's going on and getting the feedback of any issues or concerns or, again, things we think you're doing really well with.
Get the financial checkup your pharmacy needs and head over to sykes-cpa.com or call 252-482-7644.
Hey, and on This Week in Pharmacy, guess what happened? All of those, the champions of our pharmacists, I love pharmacists, my favorite provider. But for you pharmacists out there, everybody knows who's holding the ship up in your organization, and that is our pharmacy technicians. Just this week in pharmacy, there was an article that came out via Drug Topics. Shout out to the people that work at Drug Topics. Got to see many of you at the NCPA while we were there. You guys do great work. Thanks for publishing this article. And it says, meaningful recognition, what pharmacy technicians really want on World Pharmacy Technician Day. and read down through this article. I'm going to have a link in the show notes about this article. But what better person to have on TWIRx today to go through this than my friend Mike Johnston, CEO of the NPTA. Mike, welcome back to TWIRx.
Hey there, Todd. Nice to see you.
I'm not going to make it TWIRx, but just in case if you want to, you didn't even.
You do not want me to dance.
You didn't bring a Twix to actually confuse TWIRx.
Yeah.
And I'm on a keto diet right now, so I'm not into the Twixes as much. I see them everywhere, and I think of you when I see a Twix.
I am too. Like, I'm doing a clean keto, so nothing processed, anything like that, and it's been going incredible.
Me too. I've finally gotten past the 2 weeks. Someone told me that 2 weeks, the first 2 weeks is the worst part. I've been on it for about 3 weeks, and now I'm not having those cravings, not having as many sugar cravings. I'm not having the carb cravings. So yeah, I'm doing good. I'm down 4 pounds, so it's working.
Dude, it's only going to get easier from here. Like I'm on 6 or 7 months now of it. I got set up with a direct primary care doctor here in Houston that's like all about fixing metabolic health and everything. And I am down almost 60 pounds.
It's incredible.
Yeah.
Well, that's why you look like
stay strong.
That's why you look good too. And
thank you.
You the whole initiative for me is to shave down to right where I'm supposed to be, get muscly up again, get my muscle tighten, and then move on to something that it can sustain, like a Mediterranean environment. But that sounds like another podcast. I'm actually here to talk about pharmacy technicians, and I'm telling you, you really did a great job on this article. Talk to our listeners about this meaningful recognition. What do our technicians really want in celebration of World Pharmacy Technician Day, which just happened this week?
Yeah, we're a few days past it at this point, but I think there's some really valuable insights that we can glean from it. So we did a survey of all of our members a few weeks back, asking them, in previous years, did they get recognized on Pharmacy Technician Day by their employers? If so, how did they recognize them? And like, what do they want? What do they kind of see through? And overall, it's about half of pharmacy technicians reported nothing, like no wishes, nothing, just kind of pretended like it wasn't there. So that's a pretty staggering percentage for not happening. So we've got a lot of room to grow. But the main message that came from it was, whether it's Technician Day or any day throughout the year, technicians are really looking for some meaningful appreciation. They just go so often overlooked. They're definitely overworked and all of that aspect, but the overlooked part. And they weren't asking for like huge bonuses or, fancy trips. What they all focused in on, because we made it an open-ended question, like what would mean the most to you? They were saying just something genuine, something personal. So yeah, I think that's a lesson that we can all learn all year long. Just let's show the techs a little love and respect and appreciation for what they're doing.
That isn't just about the pharmacy industry either. We hear this from other sectors. There have been papers done on this. There's research done on this, that if you just reach back to your employees, especially during times that you know that they're probably being beat down by business and taking care of their own clients and working through issues, and how the pandemic kind of shook things up, and now they're back in a workforce, we're trying to get things done. If they don't feel anybody at that manager level saying to them, hey, kudos to you, we really pulled off last week, you did a great job, couldn't have done it without you, thanks so much. I think that is a way to to encourage and to get them to step up and say, if I get this recognition, that means that my superior, my manager, the person is paying attention to what I'm doing, how that has an impact on the organization, how that has impact on patients, and it gives them hope that this means that there's now a pathway for me to do something else, or get a raise, or get some type of promotion or something. But recognition shows you as an employer, as a manager, that you care.
Absolutely. It's, just people want to be seen. They want to feel appreciated. They want to feel respected. And I think we can do a much better job than, as an industry across the board.
Agreed. Well, there's lots going on at the MPTA. Mike, you've been running this organization for years. How many years has it been now that you've been running the MPTA?
This is year 26 for us. I can't believe. Yeah, 26 years.
So next thing that's coming up, just for our listeners, a shout out to you. If you're driving, if you're jogging, running, you don't have your hands free, don't worry about it. In the show notes, there's going to be a link to cphtlive.com, and that is an event starting on November 5th through 9th. It's an online, on-demand event. NPTA is hosting this. Share with us, Mike, what we can expect for CPHT Live.
Yeah, this is our big flagship event of the year. We do lots of programs and events all year long, but this is our really big one. And so it's going to be live from November 5th through the 9th. We do a couple of sessions during the week on the evenings, and then we do them on the weekends. So, but then we record them. So if you can't attend them all live, you get access to them all on demand. We're doing like 20 hours of CE. We've got some of the biggest names in the industry joining us this year. We're just really excited about it. And we make our events fun. Like, who wants to sit through boring and our events are fun. Our chat, stays busy. Everybody's talking with each other. Even the speakers every year after our event, they're like, that was the most engaged audience we have presented to, and it's all virtual, so there's no travel, no hotels, all that kind of stuff.
It's awesome. We're going to have a link to CPHT Live in the show notes, cphtlive.com. You'll be able to get your tickets there. Very inexpensive, but filled with a bunch of insights for the future. What's the future of certified pharmacy technicians and our pharmacy technicians look like? I'm hopeful because I see a lot of things changing, Mike, at the pharmacist level. Yeah. And when that happens, and there's more attention that's going to be needed on the patient to pharmacist interaction, who's going to be taking on a lot of that work to backfill prescription management and making sure things are taken care of, scheduling the telehealth appointments, taking the documentation and comparing it to the new EHR systems that are coming out just for pharmacists. I mean, there's so much that I see happening where I know that the pharmacy tech is going to be pulled back into the workflow, and it's going to create new opportunities for our techs.
Absolutely. We'd love to have them there. We even have a lot of pharmacists come and attend. The CE is accredited for both. And so if you're a pharmacist and you want to learn like what kind of emerging roles there are for technicians and how your organization can really utilize that, I think we provide a lot of insight into near and future opportunities.
By the way, are you a pharmacy owner? Are you in long-term care pharmacy, specialty, any sector of pharmacy? Do you have technicians on your staff? Do you want to get more out of your pharmacy technicians than you have in previous years? Reach out to the MPTA, get involved, ask Mike and his team, hey, what can we do to level up our pharmacy technicians? And Mike, you guys have a tremendous amount of certifications, career paths, ideas around that exact subject. So the NPTA is more than just to advocate and to rise up the voices of pharmacy technicians. It's to support the entire business of pharmacy.
Absolutely.
All right. Well, we always love seeing you on TWIRx and being part of the TWIRx. I'm going to try to TWIRx. No, it's not working, so I'm going to stop doing it. But you have to promise to come back soon, and let's interview some of your pharmacy techs out there too.
Awesome. Will do. Thanks so much, Todd.
All right. See you guys. Hey, we'll be right back with more TWIRx.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
All right, we are back this week in pharmacy. I'm so excited about the fall season. The American Society of Consultant Pharmacists annual event is happening. I think it's happening right now. The ASCP. Shout out to Chad Wers and the team over at the ASCP. We know that Dr. Tamara Ruggles will be present there. She's one of our podcasters. She does a ton of work with our network. Please look her up. Tamara Ruggles has a show on the network. It's all about the geriatric focus. So it's the geriatric pharmacy focus podcast. Her latest episode is the pharmacist role in a hospice. That's a really interesting subject. You're coming to the end of life. You deserve to be peaceful. You should make your patients comfortable. How are pharmacists working with other members of the team during that extremely sensitive time that takes a lot of respect, a lot of poise, a lot of understanding? What have you prefaced in preparation for a specific patient's need during that end life? So shout out to the American Society of Consultant Pharmacists. You guys are leading the charge in our consultant pharmacists. Hey, for listeners, go back and subscribe to the Pharmacy Podcast Network. That was the challenge that we mentioned with Jesse McCullough in the 31-day challenge. But look up these podcasts right now. We're reviewing the NASP's 2025 annual event and expo. We've put out all 3 of the episodes. And just wanted to say thank you so much to JB Consulting for supporting us in that event. Also, Counter Talk is out. Cardinal Health has had a podcast on the network for years, and this is an important topic that they're talking about, fueling independent pharmacy advocacy with the NCPA Digest. The NCPA Digest just came out. Take a listen to that episode. Get an idea of what they're talking about, the future of independent community pharmacy, and what a better time to be putting the NCPA Digest out as we just got back from the NCPA's annual event. So good to see everybody. Thank you to Nimble RX and Ural Pharma and the Real Value RX team for all of your support and collaboration while we were there. I'm excited to be working with all of you, with our sponsors, with our vendors, with people in our network. The growth of our network is just astounding. I'm so excited what's happening in our, our evidence-based standards that we're going to be coming up with for podcasting to make podcasting more reliable for continuing education, continuing medical education. The standards coming out, we're pushing forward. We're going to be partnered with other organizations, pharmacy schools, researchers, obviously some grant opportunities. Thanks for listening today to the Pharmacy Podcast Network's TWIRx in the works. If you're interested in being part of TWIRx, please reach out to me. You can find me on LinkedIn, TODD. Yuri, EURY. Look, reach out to me on LinkedIn. Let me know what your idea is. We are excited to be moving into the next week. I hope you have a wonderful weekend. We hope that you've enjoyed today, TWIRx. Please subscribe on all platforms. Let us know what we need to do to make TWIRx better as a leading source of news and information for this week in pharmacy.